Hi, this is Dr. Fatih Barut, veterinary biologist, and I will explain how we can cure coronavirus. After producing the vaccine in a short time using the method we explained in the first video, we go to second step. But before we start, a little reminder. B lymphocytes are the immune system cells which produce antibodies with the help of T lymphocytes. First, we find 100 healthy, young, non-smoker, non-drinker volunteers. We give the vaccine to them on the first day, 7th day and 14th day respectively. Using this method, which we call hyperimmunization, we stimulate their immune system to produce anti-coronavirus B lymphocytes, T lymphocytes, and consequently specific polyclonal antibodies at a very high level. At the 21st day, we let them blood donate like regular blood donation. However, at this time, we have anti-coronavirus B lymphocytes, T lymphocytes, and polyclonal anti-corona antibodies in their blood. At this step, we have two options. Transfusion of the blood directly without losing the time to the corona patient. Pros of this technique: whole blood contains not just specific antibodies, but also specific B and T lymphocytes, and we hope them to reproduce in the transferred body and continue to antibody production. Cons of this technique: lymphocytes have short life out of the body. We must hurry to transfer them. Since we transfer cells, Maillard histocompatibility complex incompatibility may reduce immune response. This should be considered. Second technique: separating serum from blood, obtain hyperimmune serum and just transfer it. The most useful part of this method is that we can keep hyperimmune serum very long time by freezing it. In both techniques, one volunteer's blood or its serum should be used for one patient. Diluting it would considerably decrease its titer and efficiency. At the research and development stage, another step which should be done is measuring the antibody titer of the volunteer serum, which shows the immune response strength of the vaccine. The best method, gold standard to do this, is virus neutralization test or its dizygotic-twin plaque reduction neutralization test. Both use the same logic. Dilute the volunteer serum in log base 2 as shown. It's not difficult and mathematical as it may sound. You just transfer half of the prior tube to the next one and mix it. Add the same amount of virus to all dilution tubes and incubate it for 1 to 2 hours. Now, inoculate each dilution virus mix to a cell culture flask. Virus kills the cells at the 3rd or 5th days of inoculation normally. However, if the serum dilution has enough amount of antibodies in it, antibodies will obstinate the virus and won't let infect kill the cells. With this logic, whichever dilution is the last dilution which is able to stop virus killing the cells is our titer value, like 1 in 256 or more. The question is, after finishing the research and development stage and make this technique routine, should we check every volunteer's serum titer before transfusion of it to the patient? The answer is yes and no. Yes, we should measure the antibody titer of the volunteer's serum because it will provide a guaranteed result. However, because of its difficulty and time-consuming nature, doing VNT and PRNT may not be feasible in an epidemic. Instead, even a simple ELISA can do the job, provided that yielded optic density values calibrated with dilutions of the positive serum, which we know its titer and whose results are validated with VNT. The technique, volunteer's hyperimmune serum, which we explained here, is also not the end. It is just a bandage to stop bleeding and fulfill emergency requirements. We need a system that doesn't need volunteers and can be standardized to produce batches of antibodies. This is antibody producing B lymphocyte and this is immortal B lymphocyte, which we call myeloma. If we combine them, we produce hybridoma, thanks to George Köhler and Cesar Milstein's Nobel Prize technique. Hybridomas, immortal antibody producing cells, are the future of medicine. Using hybridoma technology, we can produce huge amounts of monoclonal antibody cocktails and use them against any virus or any microorganism. I have a dream. One day, our children will go to the pharmacy and say, "Can I get 1 dosage of flu hyperimmune serum please?" Then they will use it and recover in a few days instead of weeks. We, humanity, survived on Earth among all the viruses and epidemics, including coronavirus, for thousands of years. I strongly believe we will also overcome this one. However, this one can leave us a gift, a technology that we can use against all the viruses. Now, whichever team on Earth who fights against coronavirus, take your chance and find it. Good luck.